Today is November 8th, 2024. My name is Charles Suter. Today I'm presenting part 3 of my series Overcoming Depression with a focus on the cure. Here's a reference for you. Undoing Depression by Richard O'Connor, PhD. And my main message throughout the series is depression is treated by removing the causes. Now this presentation is focused on a comprehensive treatment of the major causes of depression, including medical, psychological, and behavioral interventions. Now, regardless of how you became depressed, the treatment to cure depression follows a similar pattern. For short-term recovery, the standard treatment is to apply all 3 regimens to effect a quick recovery. Antidepressant medications are prescribed to lessen the symptoms of depression, while a cognitive behavioral approach is commenced to remediate a dominant cause of depression, which is your irrational beliefs and worldviews that are perpetuating a depressive state. Once your irrational beliefs and distorted worldviews are corrected, there will be fewer triggers to induce emotional distress and rational behaviors that induce your depressive states. Let's take a look at the first cure. Medical intervention to hasten recovery. Now we know that excessive adversity triggers the stress response, and the stress response depletes brain transmission fluids. What I mean by that is that brain signals, their transmission between adjacent neurons in the brain is facilitated by electrolytes, which get depleted during the stress overload. Some of the antidepressant medications, Paxil, Zoloft, Prozac, offer temporary relief. Now, regardless of what caused the depression, medical intervention is often recommended if your symptoms are severe. If you're deeply depressed, you must seek medical advice from a doctor who will assess the severity of your depression and provide an antidepressant prescription if warranted. The value of antidepressants is in reducing the severity of the symptoms of depression, so you can begin to deal with the fundamental causes, which are mostly psychological rather than adversarial. Antidepressants such as Paxil and Prozac are calming to the emotions because the threshold for triggering emotional distress is raised to a higher level before triggering anxiety and stress. The mood of patients on antidepressants is elevated, making the person feel more capable, energetic, and engaged in doing what needs to be done for their own benefit and welfare. Let's look at cure number 2. Cognitive therapy to correct thinking errors. Now here are a set of very common thinking errors amongst depressives. To accept myself, I must avoid disagreement and be accepted by everyone. Kind of hard to accomplish. To accept myself, I must be successful at everything I do. Again, that's very hard to do since we're all fallible. To accept myself, I must never make mistakes. Again, that's nearly impossible too since we're all fallible human beings. To accept myself, other people must judge me favorably. Well, not everyone's going to judge you favorably. People who have an abundance of these types of irrational beliefs and distorted worldviews are the most prone to succumbing to depression. Most personality disorders can be treated simply by helping the patient correct well-known irrational, erroneous, and distorted beliefs, such as, I'm not good enough unless I'm an achiever, or I'm liked, or I'm perfect, or I'm rich, I'm good-looking, etc. Fill in your own blank. All irrational beliefs are ultimately reflected in a patient's thoughts, actions, and ultimately emotional distress, which triggers the stress response, which causes melancholy. These irrational beliefs of personal deficiency and inadequacies will drive people to do wrong things for the wrong reason. For example, if you believe you're somehow defective, you'll be driven to hide your imaginary defects, which will substantially limit your life choices and drive you towards self-defeating behaviors such as self-isolation, perfectionism, excessive caution, etc. In addition, if you believe other people are not to be trusted, unfriendly, judgmental, and otherwise not okay, you'll respond to others with unfounded prejudices and distrust. The same goes if your beliefs extend to life itself, believing that life is not fair and you're not destined to live a good life. Depending upon how hardened and distorted these deep-seated subconscious beliefs, they can lead to thoughts of helplessness, hopelessness, and purposelessness that are the hallmarks of depression. If you have trouble changing these beliefs, then consider cognitive therapy to help you find and change them. With the proper rational beliefs, you can avoid triggering the psychological stress response to adversity that depletes the serotonin and norepinephrine chemicals in the brain, which can cause depressive episodes. The third cure: behavioral changes to cure isolation, defensiveness, and perfectionism. These are all behaviors that are characteristics of the depressive state. Consider adopting the philosophy that doing your best, that's inputs, is more important than doing best, which are the outputs. Judge yourself by doing your best, not by getting the best results. Schedule more mastery, which is productive work leading to your goals and aspirations, and more pleasurable activities. Find ways to socialize with other people like yourself in activities of mutual interest. Get out of your shell. You can often tell if a person is severely depressed by what they do and how they do it. When a person is gripped by feelings of helplessness, hopelessness, and purposelessness, it shows in their physiology, their glassy eyes, unsmiling lips, slouched shoulders. Depressed people tend to self-isolate to protect themselves from imaginary judgments of other people. People who are functionally depressed are good at hiding their depression, but their inactions with other people often give themselves away. Some depressed people are driven to validate themselves by working too hard, while others hardly work at all. There are many dysfunctional ways people exhibit their depression. So in addition to medications and cognitive therapy, a person who is depressed must find ways to break their behavioral patterns of depression by striving to behave normally. They must cease their self-isolation and workaholic ways and engage in a balance of mastery and pleasurable activities. They must become more active in useful work, recreational activities, and perhaps spiritual pursuits. Now, my final message: overcoming depression requires overhauling your beliefs and your behaviors. So just because you're trapped in the web of discordant thinking, behaving, and insufferable emotional distress does not mean there's no means of escape. Knowing the most likely cause of your depression is pre-existing irrational beliefs that drive both thinking and behaving, you can break the patterns of depression through cognitive behavioral therapy. The most powerful change you can make to achieve normalcy is to accept and find satisfaction with yourself just as you are. And if you desire changes or improvements in your life, then set goals and start working on them. Live a proactive life. Living your life with a purpose gives you something to strive for and to look forward to. So as you intentionally live your purpose, you savor both your achievements and the benefits they bring. When you abandon thoughts of helplessness, hopelessness, and purposelessness, you will have overcome your depression. When you like yourself just as you are, like other people as they are, and engage in life as if nature were neutral, you'll have returned to functioning as a normal, rational human being. Well, that's all for now. Remember to stay positive, you'll be happier, healthier, and live longer.